First off, Dr. Siegel, just sort of big picture, what are your thoughts on the passing of Lindsey Graham?
Well, first of all, of course, great sadness, and it has been emphasized the role he played, extraordinary role he played in bringing up his sister, Darlene, when his parents both died suddenly close together, father dying of heart disease. And as someone looking at the medical details, when his father dies of heart disease, a sudden cardiac arrest when he's so young, you wonder whether there could be that risk for him in terms of heart disease. And when he has a sudden cardiac arrest now at the age of 71, there's 350,000 per year of out-of-the-hospital cardiac arrests. Only 10% of them make it, because as you can imagine, you can't get there fast enough to restart the heart right away. And so most of them don't make it. The vast majority don't make it. And most of the time, it's heart disease that causes this, Charlie, like, you know, a heart attack, a sudden heart attack, especially since he was just on a long plane flight, which can increase that risk of a clot happening. Now, none of that is known, and I'm not suggesting that that's the cause. I'm giving you the statistics of what's likely. Especially at his age, you start to see sudden heart disease occurring and heart attacks occurring right around that age.
Dr. Siegel, the reports from the family say that he had a brief and sudden illness. We don't know what that illness was, but could some illness be, you know, make the heart attack more likely? Kind of help us understand that part.
Well, so what if the sudden illness were something to do with chest pain or something to do with inadequate blood flow? The coronary arteries are very, very small. They're so tiny, it's unbelievable that we get through life with them supplying the heart. So if you start to have a blockage with one, it can increase your risk that will happen, something will happen right away. Now, I assume that he's receiving the best medical attention, you know, and that he would be getting very, very frequent exams, and they would look into something like that. I mean, there's always a possibility that it was a sudden infection that occurred that got a lot worse all at once. You know, and as I mentioned about the plane flight, long plane flight from Ukraine increases his risk of blood clotting, like clot in the leg, pulmonary embolus, which is a clot in the lungs. That can cause sudden death. So those things are what I would be looking into.
And do you think, Dr. Siegel, that we will, in the days and weeks to come, learn more details about what happened? Right now, all we know is that there was an apparent cardiac arrest call made, and then he was seen leaving a home on a stretcher to an ambulance. Do you think we should soon know more? And is this a wake-up call for many of these senators and lawmakers on Capitol Hill who are in their 70s and even 80s?
There's no question about that, because I'm warning people out there that this can happen very suddenly. You can say, oh, I'm in fit shape, I'm in tip-top shape, and the next thing you know, especially around that age, it's exactly when it peaks. And yes, we should know, Griffin, the next day, literally, they can find out what caused this. They can find out the exact cause of death, whether they'll release it to us or not. I'm going to be checking on that and monitoring my sources in South Carolina. I should be able to get a definite answer as soon as there is one. They will find that out. And again, that can go to a further warning sign, especially if it's heart disease, which is the #1 killer in the country.
Well, Dr. Siegel, thank you so much for joining us this morning. We will check back in with you as we get more details throughout the morning.
Thank you, Dr. Siegel.
Thank you, guys.
Be sure to like and subscribe for all the Fox News latest on YouTube, and catch full shows streaming now on Fox One.